usual view. I've got the little tripod on. So 7 p.m. we're live. That's it. I've got no doubt in my mind that Instagram's working fine. Is Facebook working fine? I don't know. Last week, allegedly, the sound went off, but I think it went on again. Is the sound working? Who knows? Is there anyone on Facebook anyway? So I don't know. If anyone does, well, there's no point saying it because there's no anyway. We'll assume it's all working. Am I at the right place? 7 o'clock and it's Tuesday. Yes, I am at the right place. So if you've got any questions, by all means, ask me directly. If you haven't got any questions, then I'll be talking about some questions here, which you may or may not find interesting. If you find interesting, then stay. If not, then keep scrolling or whatever you do on Instagram or Facebook. But yeah, here, see if I can keep your attention. So question number 1 is, why do other clinics offer discounts / incentives to book surgery, but your clinic does not? Right. Well, we're not allowed to. I guess there's 2 reasons. One reason is we're not allowed to. So even if we wanted to, we're not allowed to because we are members of BARPS. BARPS is the Plastic Surgery Association, British Association of Aesthetic Plastic Surgeons. And if you're a member of BARPS, you are not allowed to offer any discount or incentive because you are not allowed to be seen to be incentivizing surgery. Surgery is a medical procedure. People kind of seem to think that cosmetic surgery is somehow more of a commodity, more of a purchase. But at the end of the day, cosmetic surgery is still surgery, and it's a medical procedure performed by a doctor, a medical professional. And so it is not something that should be encouraged. If a patient is right for surgery, then they're right for surgery. If they're not right for surgery, then they're not right for surgery. We are not allowed to say, if you book this month, you'll get £500 off, because that will be incentivizing someone to have a medical procedure, which is against the BARPS guidelines. So that's one reason. And we are all BARPS members, and that's the problem, is that when you're not a BARPS member, you can kind of do what you want. So a lot of people offering this sort of surgery are not BARPS members, and so they don't have that kind of code of conduct to work towards, because I do think that some clinics do offer discounts and incentives. But having said that, even though that is the case that we don't, because we can't, also it doesn't really fit with the kind of the brand and the brand ethos. We're not really looking for the end. I mean, I know price is an issue. I know it is. But we do not kind of attract patients who are looking purely on price. If you're looking purely on price, you will get it cheaper elsewhere. So it is a competitive market, and we do try and be competitive, and I think we are competitive, but we're competing in terms of the care that we're giving, the service we're giving, the amount of contact we have with patients. That's where we're trying to compete with other clinics. We're not trying to compete with other clinics on price. So if price is your only sort of discriminating factor, then we're probably going to lose. But if you are looking at the service, the aftercare, the training, the expertise of the surgeons, then I think we can compete on those things. So, and I've always said, you can't really compete on both. You can't compete on service and on price. You know, if you're going to have the best price, you can't have the best kind of luxury kind of service and have the cheapest price. You can't do both. You have to choose which one you're going to do, and we're choosing to go on that one rather than the price one. So we are trying to push everything into the amount of value that we give in terms of the service that we give, rather than giving, cutting costs and trying to do the sort of cheapest. So yeah, having a discount or an incentive doesn't really fit with the brand. Doesn't really fit with the brand. And the other thing is that I'm not a massive fan of Apple, to be honest with you, in terms of the computers. I'm all right with the phones, but it makes it a bit easier. You know, if you go with Apple, you know, Apple, you never give discounts, do they? So it makes it a bit easier, doesn't it? I find, if you're going to buy an Apple, because you just buy it any time. With other stuff, you kind of always thinking, oh, well, there's going to be a discount. Is there going to be a Black Friday thing? Is there going to be a, you know, discount, something like that? So you might not go. So, you know, you can rest assured there's not going to be a discount, not going to be a special offer. There's not going to be a Black Friday deal. There's no discount for cash. In fact, cash is a little bit difficult to manage because you have to go and pay it in at the bank and stuff, and they charge us. So actually, we prefer a bank transfer than cash, to be honest with you. But anyway, there's no discounts anyway. Essentially, the only way there is, I shouldn't really call it a discount, but if you are having a joint procedure, it is cheaper than having the two procedures separately. That's not like a discount or incentive. That's just because it's one hospital stay, one surgical pack's opened, so there's an economy of that, and so that is passed on. So that's not necessarily a discount if you have two procedures, but it's just basically cheaper because it's cheaper to fulfill that. So it would be kind of not great if we just added the two together and charged you, because that wouldn't be in line with what it was kind of costing us. So yeah, we do not offer any discounts or incentives, so you don't have to ask. It's a bit like those car dealerships, you know, like Motorpoint and stuff. I find it quite, I shouldn't name names because I don't know if that is one of them, but some of them they say, look, don't haggle because it's already the best price. I feel like saying it makes it a bit easier. Certainly for me, I don't really like the haggle stage of it. So you know, for some reason, some people, it might make it a bit easier because you don't want to feel like you're missing out on a deal if someone else is doing a bit of you know, a bit of wheeler dealing and trying to negotiate on the price. You think, oh, why didn't I need wheeler deal? So there's no wheeler dealing, no incentives, no no discounts. Do we use drains when performing surgery for a tummy tuck? Yes, we do. And when preforming, we do. You know what? I think one of the problems with this day and age is everyone gets on the internet and they all get onto quite technical stuff. And I'd consider drains to be quite a technical thing. And if I was a patient, I wouldn't worry too much about it, whether you have a drain or not. That's not going to be a big deal, I would say, for whether you have surgery or not. I mean, maybe it is, I don't know. But a lot of people kind of get into it. And I'm like, it's kind of like a surgical thing there. And there is an issue around the use of drains in general in plastic surgery, and we are moving away from them, and there are many surgeons who are not using drains for tummy tucks, and there is certainly a benefit in not using a drain because patients don't like drains. Patients don't like drains, they're uncomfortable, potential source of infection. There has been, and certainly I have had a case where actually putting the drain in has caused a hematoma because I think I must have nicked the little blood vessel and I put a little trocar in. So they're not without their issues. However, if someone tries to tell you, oh, I don't use drains and it's much better not to use drains, you've got to say, well, why do people do use drains? There's got to be a reason to use them. So you've got to see both sides. So I completely acknowledge the benefits of not using drains. And as I say, I've moved away from them in most of the surgery that I do, but I still use it for tummy tucks simply because mainly for seroma rather than hematoma. So seroma is kind of wound fluid that can collect a week or so afterwards. Hematoma is blood that collects instantly, the day of the surgery, and you can still get a hematoma even with a drain. But the seroma is much less likely with a drain because the drains we use as suction drains under a negative pressure, so they suck the two sort of space together. I do use quilting stitches to close down that space, but I do also augment that with a drain because I feel that there is less risk of seroma if you can get those two layers to stick together, personally. And there is evidence out there to say that it is safe to not use a drain. So the people who are not using drains are, you know, within the scope of normal practice. But then there are also people like myself who do use drains. So it's acceptable both ways, and it's really just about experience and surgeons' kind of views on it. And when you look at the figures for seroma and things, they say, look, there's quite a low seroma rate for people who don't use drains. But my seroma rate is really low in terms of the fact I've had one that I can remember Certainly for a cosmetic tummy tuck, I've certainly had more when I'm doing DIEP flaps and things for patients who are having breast reconstruction. But in terms of cosmetics, I think I've only had one. It was many years ago, like 10 probably years ago. So anyway, but so there's pros and cons with drains, and it's something certainly to discuss. It's an interesting one. Do you use Arion, Polytechnic, or Nagor implants? Honestly, who's written it? I think this is this Amy's written this? Arion, Polytechnic. Well, now Nagor, yes, Nagor is a maker of implants. Is Arion a maker of implants? Arion? Is that actually a thing? I've never heard. I mean, this is where it comes to. You should have done the research before you've done the Arion breast implants. Oh my God, it's coming up. Laboratoires Arion. Right, they do. Oh God, no, don't tell me Polytechnic exists as well. Polytechnic breast implants. Now Polytech, I think you mean Polytech. Do you? Now Polytech I'm okay with. So Polytech, yes, I use. Nagor I use. Got to be honest, full disclosure, I've never heard of Arion breast implants, but they do indeed exist in the world. Arion breast implants, who knew? There you go. So no, I don't use Arion. No, right. It was my father, Dr. Arion, plastic surgeon, invented them. Okay, sorry, Dr. Arion, I wasn't familiar with your implants. What I would, so yeah, is that the question? Do you use? So I use Nagor and Polytech. I do use the Polytech, the Nagor. I can use any make. I'll be honest, I've never used Arion, never even heard of Arion. The only sort of disclosure is the hospital needs to be able to get them, so we need to be able to get the implants. But I'm not tied to any manufacturer. So if you've got a view about a particular make, I will use it. I would be a bit anxious about using one I've never heard of. I mean, there's quite a few big companies: Mentor, Seba. What's the other Polytech one? Oh, there's another Polytech one. So Polytech, sorry, not the other Nagor one. Nagor's UK. There's a French one. Oh, it's GC Aesthetic. Anyway, that's going to do me in now. So anyway, I use any make that I've heard of. I've never heard of Arion, so I would be anxious about using Arion. But certainly Polytech and Nagor I use regularly. Used Polytech today. Motiva is the other ones, but they seem to be big at the moment. But I use any kind of make as long as I've kind of heard of it and we can get hold of it. And again, the main differences in the implants is in terms of the surfaces, and the makes have slightly different warranties. So that's something to be aware of. So we can certainly discuss the differences in terms of warranties. And as I say, from your point of view, it's going to be mainly the shell that's going to be different, and the risk profiles are different with different shells. So I use all the shells. I use smooth shells, textured shells, polyurethane shells, and they all have pros and cons. So I will use whatever you want after a discussion about the pros and cons of all of them. I'm not one of these people who just use one type of implant, and personally, I think not. I think probably some patients quite like it if you just use one type because it takes that decision away. But I feel like you've got to have a discussion with the patient about the pros and cons and let them know what's available. So that's what I do. I try to let them know what's available. Let you know, not them, you. Peony, what you got? First, thank you for this morning. Right, God, Peony. You see, this is the problem when you have people whose names are different to who their real name. Right. Thank you. That sounds a bit dodgy. Thank you for this morning. My meds are slowly wearing off with discomfort, increasing. No pain and manageable discomfort. Would you stay camping before bed or holding off? Right. Right, Sarah. Okay. Yeah. I think before bed. I mean, I usually go with ibuprofen and paracetamol, kind of normal painkillers. And you can't go that far wrong. The only thing with ibuprofen, you've got to be a little bit careful because it can upset your stomach. So if you're going to have something to eat, maybe have some ibuprofen, but certainly paracetamol. The other one's the codeine. I don't know if they're giving you codeine, but the codeine ones, you've got to be a bit careful about constipation. So you don't want to take too many of those. So I wouldn't necessarily kind of take them just for the sake of it. I think it's not unreasonable to have some painkillers before bed just to make sure you get a good night's sleep. But if you're not in much pain, I probably wouldn't go too heavy on the painkillers. And yeah, codeine. So codeine's good painkiller, but it makes you feel dizzy. I don't know if you had it before. It makes you feel dizzy, makes you feel sick, makes you feel constipated. So just be a bit careful. So with that, and I would probably, if you can, stick with the ibuprofen and paracetamol. And I think it'd be reasonable to have one before bed, just because you get a good night's sleep, because sleep is important. So yeah, and I'm good. If you're not in pain, yeah, don't take them regularly, and hopefully you won't be in pain. You know, good. Yeah. What's that, Jake? After having a breast reduction in 2019, I feel that I have excessive tissue fat below my armpits bra line. Is liposuction an option to remove this? I'm not overweight. I've tried exercise. Thank you. Yes. Is it Jake? Yes, it is an option, and this is can be an issue when you do a breast reduction. It's something that sometimes you don't kind of notice so much when you do the when you're sort of focusing on the breasts, but often patients have a bit of lateral fullness, and you can't really get to that lateral fullness with a breast reduction. Same way with the tummy tuck, you can't get to the lateral sides. It kind of peters out towards the sides, but you can get to the lateral fullness with liposuction. So sometimes you do it with at the time of a breast reduction, but certainly if you've had a breast reduction and you feel you've got excess there, liposuction is one of the areas that liposuction does work well in those sort of side lateral chest wall area. So for sure, that is for sure an option, and good that you've preempted that overweight thing, because if you are overweight, obviously weight loss is good to do first. But if you're not overweight, then yes, liposuction would definitely be an option for that. Hi, Joe and Sarah. Thank you for your names. But yeah, for sure, that would be. Thank you. Right, simple, not so much a question. This is like more of a statement. Post-op breast implant scars on black skin. That's kind of like a statement, really. I'll make a question out of it. So maybe the question is, what do breast implant scars look like on black skin post-op? Would be probably the question I would make out of that. Yeah, pretty good. Pretty good. I think, I mean, breast implant scars usually fade pretty well. They're about 5 centimeters long in the fold of your bra, and they usually fade pretty well. So you don't often get problems with them. Obviously, you can get problems with them, just like you can get problems with any scars. And I think specifically this person maybe has mentioned black skin because you can get more problematic scarring with darker skin colors, hypertrophic keloid scar, particularly if you've got a history of a keloid scar. I would be worried. But if you haven't got a history of keloid scar, there are certain areas which have got an increased risk of keloid scar: shoulders, chest here. But the breast implant scar is not a high risk area for a keloid scar. So if you haven't got a history, just because you've got black skin doesn't necessarily mean that you would have a higher risk of having I wouldn't particularly worry that you're going to get a problem with it. It usually settles pretty well, that scar. But just like anything in terms of having surgery, you've got to weigh up the risks versus the benefits, and there are risks that the scar can become hypertrophic or raised, but it's very rare. I think I'm right in saying I've only seen it once. I think I probably have seen it more than that, but the one that I can remember, and that was on a Caucasian patient, had quite nasty scarring. But usually the scar settles beautifully in all skin types. Same, I mean, breast implant, I mean, more a worry with breast reductions, breast lifts, because they're kind of around the nipple and they're on the front. So that would be more of a worry there. But even then, it can still settle beautifully in all skin types. And the hope is always that it will. But you need to be prepare for the worst and hope for the best. That's the motto of the clinic, right above the door. Will a flat mole disappear by its own? If not, then how to remove naturally and how to make lighter? I did a video a while ago about how to remove a mole naturally, because kind of like a mole in itself is natural, so there's no natural way to remove it, because it's it's pretty unnatural to surgery, I guess. God, there's a philosophical debate there. Surgery is unnatural, isn't it? It's against nature. Nature is doing things the way it wants to do things. And medicine, I mean, let's open it up. Is medicine unnatural? I mean, let's discuss that. Is intervening with the normal process of events? Are we getting in the way of nature? Is everything unnatural? Is building roads, is that unnatural because we're meant to like walk wearing clothes? Is that unnatural? Anyway, going back to the mole removal naturally question. So yeah, I get a lot of this on YouTube about removing a mole naturally. I don't, you know, I think what they mean is like at home with some kind of vinegar or whatever, cod liver oil or something. I don't know. There's all. So I'm not your man if you want to know how to remove a mole at home. I wouldn't recommend it. And certainly a flat mole. I mean, if anything, a flat mole is going to be more likely to be concerning than a raised mole. Raised moles are often, that's not a bad sign of the fact that it's raised. They're more troublesome, but they're often more likely to be benign, a raised mole than a flat mole. So, you know, you would have, well, I would say you should get it looked at least to make sure it looks okay. And if you are going to remove it, I would say it is good practice to send it for histology. I mean, maybe not all of them. Maybe you can say, look, that's definitely fine. You don't need to send it to histology, but at least have it looked at. And you can't do that if you do it at home. And, you know, is there a way to make it lighter? Well, there's bleaching it. I mean, the short answer is no, I wouldn't get into it. But there are things like bleaching agents and what have you can use to bleach the skin and potentially bleach a mole. But yeah, you don't want to go there, because how are you going to get the bleaching agent just on the mole? How are you going to know how much to use? What if you bleach too much and it goes depigmented, or not enough and it's still colourful? It's just not something I would get into at home. In a nutshell, you can't really assess and treat these things on your own. And a flat mole, you know, the natural thing to do is to leave it alone. If you want to have it removed, get it looked at by a doctor, and if it's benign, then you can make a decision cosmetically whether it's better to have it removed or not. But I would get a doctor to remove it in the most effective way possible, which means removing as little tissue as possible to get rid of the mole, but removing enough tissue to make sure that it doesn't come back again. So removing as little tissue as possible so it doesn't scar as much. So the less tissue you remove, the less scarring there is, but removing enough so that the mole doesn't come back. That's the problem when you start doing things at home. It's judging how much, if you're using some kind of acid or some, I don't even know what these people use at home, but I'm presuming there's some kind of acid or something to sort of burn the skin away. How are you going to know how much of a burn to impose on that? Because if you don't burn away enough, then the mole's just going to still be there once it's all healed. And if you burn away too much, then you're going to get more scarring. So, you know, that's why when we do surgery, we just try and remove the offending area, and we try and minimize the amount of scarring and minimize the amount of trauma we do to the surrounding tissues, which is not something you can really do at home. So I wouldn't recommend trying to do anything to make it lighter or to remove it at home. I would recommend you see a doctor. And I know what you're going to say. Oh, you would say that because you can go see a doctor, your GP, and just get it checked if you know if it's benign or not. So if it's not a cancerous mole, yes, they probably won't help you, but at least that's one thing that they're going to tell you whether it looks cancerous or not. Because obviously, if it does look cancerous, you don't want to go messing with it and putting stuff on it. You want to get it off and get it sent to histology, because you know, skin cancer is a serious thing, especially moles, which can turn cancerous, is a very serious, potentially serious problem. Now, this was a comment I remember seeing on YouTube, and I believe I answered on YouTube. I recently got dissolvable stitches on my lip, and they've been there for 3 weeks. Should they have gone away by now? This is my dissolvable stitches video, which does very well on YouTube. It seems to get a lot of comments. Not all positive, but you can't have that. You can't always get all positive comments, can you? You know, when you're a social media influencer, when you're in the public eye, you've got to accept that you're going to have people who are going to want to tear you down and say you're being unhelpful with your video, because basically, like I say, it depends on how long it takes to. I think the title is "How long does it take for a dissolvable stitch to dissolve?" I don't know how long the video is, but basically, I say it depends. And a lot of people say that's unhelpful, but you know, it is what it is. And the thing I always go back at people, because I get loads of people saying I've had dissolvable stitches here, there, and everywhere, and they're still there. What should I do? And I'm like, talk to your doctor is your bottom line, because your doctor knows what stitches you used. Number one, because that's what the type of dissolvable stitch will depend on how long it takes to dissolve. Some dissolvable stitches take longer to dissolve than others, so they'll know which one they've used. They'll also know how tight the wound was, so they'll also know when the stitches have done their job. So when the stitches have done their job, if they're still there, they can be removed. You can remove dissolvable sutures if they're still there and they've taken too long to dissolve after the wound is closed. But that's really for you. I can't say whether 3 weeks is probably enough, to be honest, but I can't say whether 3 weeks is enough, because your doctor might be really worried about how tight it was and might say you've got to leave it for, just leave it, it's fine. Or they might say, look, it wasn't tight at all. If it's still there 3 weeks, we'll remove them for you. On the lip, on the pink of the lip, it doesn't really matter if you leave stitches for longer, to be honest with you, as long as they're not causing problems, getting inflamed or anything like that, getting infected. It's when they go across onto the white of the lip, onto the sort of skin color of the lip, because you worry about getting little dots. If you leave stitches for too long on that bit of the lip, then you worry about getting little dots. So if it is 3 weeks and they're on the sort of skin of the lip, I think it probably would be useful talking to your doctor to see whether you should have those removed, because you don't want to get those dots. The classical stitch with a line with dots on either side, sort of like a, Popeye sort of cartoon scar. Those dots are those stitches that have been in for longer. And so for somewhere like a face, we try and get the stitches out quicker, because we don't want those little dots to appear, because we want to get a nice looking scar. But as I say, if little dots appear on the red of the lip, it doesn't matter, because you can't really see the dots because the lip's red. So that's my angle on that. So Facebook things going around, no comments. Who knows if the audio worked? Hope it did. Hope the audio worked. I have no reason to believe it didn't. I don't know what to do when they say it doesn't, but anyway, we'll just cross over that. Instagram always right behind me. So I'm out, by the way, of questions. So if you've got any questions, you are welcome to ask me, and I will do my level best to answer it. Post-op pain relief or anything like that. But in the absence of any questions, I will, usual, put my feet up. Next week, be here almost certainly, won't I? It's not holiday or anything. Coming up to Christmas now, isn't it? It's exciting. So yeah, I'll be here next week. So if you have got a question and you don't get it in time, don't worry, because I will be here next week. So it's not really too much of a panic. So yeah. So without further ado, I will see you next week. Top the stream.